Hi, let's talk about the outcomes of contemplative practice as it relates to counselor training and also the hope for outcomes and effort that you would need to make to maximize your training in this course. So, generally, contemplative practices are seen as a practice that increases one's self awareness. So, in this course, at every moment, you can ask yourself, what am I feeling? Why am I feeling this way? Have I felt this way before? What are my own personal roots of this feeling state that arises within me? You can say, have I felt and thought these thoughts regularly in the past? Is there something about this particular situation, something about the leadership, something about someone else in the room that's promoting these thoughts? So when we talk about first person contemplative education, it doesn't mean checking your intuition and your impulses, which can often be in a more regressed kind of state in some kind of coping mechanism or defense mechanism. But first person contemplative education is putting in effort to contemplate what is happening for you, why it's happening for you. How do you understand this? What might you be missing in your narrative about your current experience? How can you expand that? How can you learn both from others in second person contemplative education and also from the canon of knowledge that is out there from all spiritual traditions, psychological traditions? I'd go talk about anthropology, art. So it's not being I feel this way and therefore it's bad. It's like I'm feeling anxious, I'm feeling sad, and then a deep contemplative exploration of this. Ideally, you would do this not only while in the group, but I think if you want to maximize your learning and your growth, you would take some time contemplating these questions outside of the course itself. So contemplative practice really also stresses this idea of self-regulation. So being part of a community group, being part of a cohort, being part of any group, or even being a person in the world, we have lots of stimuli coming out of us, often complex, overwhelming, contradictory. So the challenge, particularly because this reflects being a therapist, is that how can we stay regulated? How can we be in touch with ourselves? Is that through breathing? Is that through purposeful detachment and dissociation for 30 seconds? Is this letting our mind run into a fantasy and then bringing our mind back? So this is a vital skill, self-regulation, for being a strong therapist, is that what the stories you will hear, the pain that you'll sit with, the injustices that will get increasingly broad in your time and practice. So often self-regulation in the research, whether we look at dialectical behavior research or other mindfulness practices, it's really the practice of coming back, of noticing when you're going off, and what skills might you use to come back so you're able to be with yourself and be with others and not lost in some dissociative old narrative in some way. So along with this idea of self-regulation and contemplative practice, it's distress tolerance, another vital skill seen in the research around being a effective therapist. So just as a therapy practice or following the news or being in a cohort can create a lot of distress within us, how can we broaden our ability to be with the pain of others, to be with our own pain, to be with distress? How can we remain open and curious about it and learn from it, as opposed to when feeling frustrated, confused, overwhelmed, which will happen in your clinical work, that we don't run to some old narrative that this is bad or they should do this or that, right? Our classic projected processes. How can we be with ourselves? Why am I feeling distress at this moment? Is this distress a similar distress that I felt in the past? Am I feeling scared? Can I talk? Why am I feeling scared? Have I felt scared in the past? Am I feeling bored? Is that a common feeling for me? Am I feeling the desire to really connect with others? Is that an old feeling for me? So these variety of what would be countertransference feelings in therapy, or just our own feelings when we're in relationships, whether in a dyad or in a group. How can we increase our tolerance through practice and through awareness, so we can be with our clients and be with others in our lives and also with ourselves in a more constructive way, in a way that has more possibilities and openness. The third outcome of contemplative education would be increased compassion. So as you sit in the group, you can think about what are others feeling? Who's feeling excluded? Who's feeling misunderstood in some way? What are my judgments that are coming up around this? Are there other perspectives beyond my particular judgment? And this gets linked into what the Dalai Lama would call kind of the root practice in Buddhism, which would be kindness. So in each moment, am I being kind to myself, to others? Am I accepting self and others, even if I disagree? Can I try to understand their viewpoint? How can I respond in a way that will broaden the conversation, help us be in connection, even if we see things differently? This is a very big practice of mine, as while I try to remain open through my years of study and practice, I have many ideas about clinical training. I have many ideas about possibilities in clinical work. But even when I'm with colleagues or I'm teaching, how can I be kind even when there's a disagreement and a misunderstanding? This is a vital skill. Sometimes I'll say it this way, shocked really by the lack of kindness that I can see within groups. So you can almost ask yourself this repeatedly. What is the kind thing in this moment? How do you understand it? It doesn't mean signing off and co-writing something that you disagree with, but it also doesn't mean thinking that you're right, thinking that you understand the complexity of the other person or the topic being discussed. And how can I engage so we're on a team rowing the boat together? How can I call in others, and how can I present myself in a way that others will stay in relationship with me so we can learn and grow together and from each other? So another aspect of contemplative education and how this applies to community lab is relational awareness and relational skill awareness. So you could ask yourself, what am I feeling towards other people? Look around the room. What am I feeling towards this person, that person? Why am I feeling this way? What might I be projecting on this other person? And, right? And then as you communicate in the community lab class, oftentimes things will get dropped or not picked up on, but that doesn't mean that you haven't been making an impact. So you can notice how people talk with each other. What comments and what ways of communicating do you like? Can you learn from? What ways of communicating don't you like that you can also learn from? What is it that you want to say, and how can you say this in a manner with kindness and the ability for others to hear and for others to take in, for an ability to be part of this team that is Community Lab. So you can get the most out of this experience and get the most out of your experience at Naropa. Each moment that each one of you do in group is a moment of karma that influences the whole group in some way. So there's many, many models of relational skills, curiosity, asking questions, although I would promote you to do the hard work, which is a common practice in settings where we're working with group dynamics, is what is getting triggered in me for me to want to say this, right? Behind every question, there's often something happening for the questionnaire, a memory, a theory. So can you continue to deepen throughout the semester to bring greater awareness to what you want to do in relationships, why you want to do this in the relationship in this class, what might be the impact if you did this, what are other possibilities, how may other people who you admire present such information. So you'll be able to notice the variety of communication techniques and relational techniques and strategies and skills and other people's nature, and you can expand your relational skills through the observation of this. If you see someone who communicated really well, I'm very much into people showing gratitude, right? It's part of contemplative practices, gratitude. Can you say that I admired this? Why did you admire this? Right? Our culture is generally, from the Judeo-Christian Puritan tradition, is really about a really, really big focus on mistakes or sins. What sin has others have done? What sins are we doing or trying to avoid? Can we, I think of the Jewish term mitzvah, can we celebrate other people who are doing a wonderful job? The average American child, and there's research in other cultures that show this is more intense or only slightly less intense, receive 20 comments of criticism and correction for every one comment of praise, of being recognized, of being appreciated. Can we change that in this group? Is this group going to be a repetition of everyone's childhood and our cultural experiences of negativity and critiques and of distancing? Or are you able to go deeper and bring out the gratitude that you may have? This is a very, very unique experience. I'm not saying this is an easy experience. And I know the leaders and the instructors bring tremendous amount of effort, tremendous amount of experience, tremendous amount of awareness. So this would be a very positive way of changing, kind of a small action to change the cultural dynamics that were embedded in some way. The next outcome and practice of a contemplative education as it applies to Community Lab is curiosity, not jumping to one's pre-created narratives. This person's like this group is doing this, right? But what are you potentially missing? Why are other people's having different experiences? You have a great opportunity here to be humbled in your own subjectivity, that other people, everyone in this course will have a different experience with some similarities and some differences at every moment. Why are you having the experience you're having and others are having different experiences? And go beyond because you're right or you know best, right? The biggest headest symptoms that come up with counseling students is common, right? You're learning so much information that you didn't know before, and you're gaining so many insights and such awareness that you can think that you are really something big now. But luckily, you're going into this field, and this field will repeatedly humble you as you work to reduce the suffering, increase justice in the world. It's a very challenging task, and the more you learn, and the more you learn more deeply from others about yourself and from how other people understood the world, the greater flexibility you will have in working with others. And of course, this idea of flexibility and adaptability is, the keynote of diversity counseling at this point, that we have to be curious and we have to be flexible. Perhaps the group process isn't going the way you like, but why is that for you? Right? Why do other people would like to do this in some way? So something I would never want any of you to do in this course is to interpret another student. To say, like, you're doing this because of that, something you might have learned from their past. It's such a defensive, sadistic even way of communicating with others, right? Is there a way that you can bring, I'm thinking this because of that, or I've had a similar experience to that? But, often in the tenseness of organizations and in systems and in this course, often, as the mind does, seeks simplicity, seeks a single cause, right? And this is atypical, and this is parenthetical to the teachings of Buddhism, where we're constantly expanding and not looking for a single cause, but looking at the multiple interactions, the very complex web of karma that is creating each moment in our lives, in each moment in this course. So moving on to the next key area would be develop conscious attention modulation. This is seen as a vital skill as a clinician. So are we able to modulate our attentions, or has our mind hijacked us when we're just going in some old repetitive patterns that we have that has been burning deeply into our default networks of our brain? But can we practice questions such as I presented? What am I feeling? What am I thinking? Am I feeling more? Am I thinking more at this moment? Right? What are other people feeling? Right? Why do other people think what they think? Can you constantly go back among these various states of awareness, states of consciousness? So this is written about a ton in the field, going back to Freud's free floating attention up to bell hooks, awareness of others' identities and histories and how that impacts their current experience. There's a little paragraph that Karen Bustamante and I summarize some of these ideas of how to be a clinician, and I think you can practice how to be a clinician in this course, right? Can you continually not go down just a self-focus or other focus or caretaking or feeling or thinking or dissociation? Can you actively work with where your conscious attention is? And it may be challenging. There will be pulls, as we learn about in the skandhas, but can you take the effort to notice when you're over fixating on one point and come back to the present moment in some way? And if you can't do that, because we all can't do that at times, right? Can you take time outside of class to reflect on what was that like for you? Where did you get stuck? What are your habitual patterns? Or are you mainly a thinker or feeler, interested in your own needs, interested in other people's needs? Are you fixated on the course instructors? Are you fixated on some subgroup within the course, whether it be age or race or gender or sexual preference or identity or social class, right? How can you continue to expand your areas of focus? And over time, we train our minds as clinicians, particularly in this program, to be able to hold many, many ideas and many perspectives simultaneously. So I think I see this course as an opportunity to expand oneself, to get outside of one's narratives, to understand how other people see the world, how other people experience the world, and particularly what dynamics happen when people come together in groups. And I'll make many videos about the various dynamics, whether it's groupthink or scapegoating or splitting or anti-group. So that would be your effort. How can I, in each class, really almost in each moment, how can I have my perspectives be broadened? How can I bring compassion and curiosity? How can I bring deep listening to others? And how can I understand the world and dynamics within systems, within a classroom, in increasingly progressive in new ways, with increased complexity in nuance and appreciation of the complexity of the web of karma. So these would be the kind of ideas of why we do this course, and I feel like Dr. Bustamante and I and Dr. Olson did a wonderful job in kind of highlighting that. I really would recommend you reading that article with attention and depth. But as you go through the course, and I know you will be busy, I would maybe sign up and join some YouTube videos or find some short dialogues about how different anthropological theories understand group interactions, or what are common in social psychology, or can you look at organizational systems in psychology, or world transformational practices, and can you continually widen your perspective to use these different lenses, none which are completely accurate, to understand the dynamics that are occurring in your experience. So I think that's enough for now. I hope you have a wonderful time. I hope it's transformative as it can be. That's part of the practice of these groups is, I guess I'll add a few more comments, and I know I can go long, but the idea of contemplative practice and transformative practices is to connect with something bigger than yourself. How can you repeatedly come back and connect to the experience of others, even the instructors, the other people in your environment in some way, right? How can you find your way of participating in any group or in this course in a way that will help others grow, increase their awareness, increase their feelings of inclusivity in some way? How can you have a goal that may be larger than yourself within each moment in this course, right? This is, right, the research is overwhelming that having life purpose, service to others, core idea of Buddhism, actually produces more happiness and meaning, and is also a very, very challenging path. So part of contemplative practice is helping the class, helping the instructors, right? How do we work together, right? How do we not just deny or become self-centered, right? But how do we do more than just cooperate to get along, to go along, but how, as Harry Stack Sullivan's developmental model of relationship, which suggests how do we collaborate in this course, but also in each moment of our lives for everyone's benefit. I think holding that goal has been very helpful to many of my deep relationships, including with the leaders of this course, and also, with my family and with my various communities. So, as you see, this is all takes a lot of effort. So, this means constantly staying open and curious, and through that practice, you will develop maybe the core skill of successful counseling, which is you will have presence. How can you practice having presence and openness in each moment in this course, right? That looking at the counseling research, it's not about what theory is most effective, because most theories have pretty similar outcomes in some way. But this therapist presence of being aware, of bringing effort to your attention to the many facets of what's happening in this course. You practice this in this course, and then when you go out in the world, you can bring this to clients, you can bring this to groups if you lead groups. If you stay in this field, I think you have wonderful training. You'll probably find your way into leadership positions. How can you bring this presence into the communities you're part of, into other people that you are working with? So the final idea of contemplative practice and the idea of seeing community lab as a contemplative practice is psychological and spiritual transformation. That with effort, with curiosity, with openness, with presence, with humility, you have the opportunity to be a much more expansive person, to have more flexibility in your relational skills, have more flexibility in your thinking, have more ability to tolerate strong emotions from others, and that you will leave this course different than how you've entered. And that will serve you, your clients, and all the world and everyone you're around in a constructive way. Take care.